one of the questions that is asked is, what kind of genetic abnormalities the couples can benefit from PGD? And it's really important to know because there is some study to suggest that physicians that are outside internists, neurologists, pediatricians, even gynecologists, don't really up to date in preimplantation genetic diagnosis. So they don't feel comfortable to talk to patients about it. And in the result of that, many patients that may benefit from IVF with preimplantation genetic diagnosis are not aware of it. And many of them will come to us because they've learned it on the internet. So right now, if you are carrying a single gene mutation, that either it's a recessive or dominant inheritance, meaning that you will have the disease, or if your partner also is a carrier, then the baby may have a 25% chance to have the disease. Then actually, rather than, if you prefer to avoid the difficult dilemma of whether to do preimplantation prenatal testing and to find out whether the embryo is affected or not, than to face a difficult dilemma whether to terminate the pregnancy or to continue and to deliver an affected child, we actually can test the embryo pre-implantation, do a biopsy on day 5, 6 of the embryo, freeze the embryos, test it for the genetic abnormality. We also would advise you at the same time to test for chromosomal abnormalities, because you may come to us for avoid cystic fibrosis or thalassemia or any other common disorders or uncommon genetic disorders that unfortunately you've been carrier for, but at the same time we can check to make sure that the baby doesn't have Down syndrome or any other chromosomal abnormalities. And it's for the patients, the couples, to decide what they want to test for and what they want to avoid. It's not for us. If the couples have chromosomal rearrangement, like translocation, that they have been suffered from repeated miscarriages, preimplantation genetic diagnosis can increase significantly the chance to have a live birth. If they have a child that may suffer from a significant disorders, whether it's hereditary like thalassemia or anemia, sickle cell disease, that they need chronic transfusion, or bone marrow failures, or whether they suffer from leukemia and they need a bone marrow transplantation to be saved. Now we can actually offer this couple to go through IVF with preimplantation genetic diagnosis and to test the embryo, one, to make sure it's healthy, and second, to make sure that it's an HLA match or tissue match, the same test that we do for transplantation, that the newborn will be matched to his sick sibling, and actually they can use cord blood or later on bone marrow to save his older brother or sister. And we have experience with that for many years now. This technique has been on for 15 years now. And the first baby was born after HLA typing in 2000. And actually there was a meeting here in Chicago, and I just met the first kid that was, now she's fine. She just graduated college after her brother was born and saved her life. So it's really amazing to see the stories of the couples and what they need to go through. And we have a lot of experience with that too. So in a way, we can check today for single gene disorders, translocation, to have HLA matching to help the sibling that is sick. And we can do all of the same. So we can check for the mutation, for HLA, and for chromosomals at the same time. It doesn't mean that we have to do more biopsies. We just do more genetic testing.